Buenas tardes. Okay, it's really a pleasure to be here. Thank you so much for this opportunity. From the assigning of the Affordable Care Act in March and the nail-biting moments that led up to its passage, to the election last week where the balance of power in Congress shifted, this has been an extraordinary year. With the passage of the Affordable Care Act, new opportunities have opened up that could change the way that we do public health work. Opportunities for better nutrition, increased focus on community participation in designing where we live, work, and play, as well as strategies that will improve our ability to measure the quality of our health care system and incorporate standards of population health. These all stand to change our sickness care system into one that helps to keep people healthier. The Affordable Care Act does not begin to truly inform or reform health care in our country, but after nearly 100 years of various administrative efforts to change health care, we do finally have the beginning of defining some vital consumer rights and starting to measure health care and the impacts of health care in a way that actually holds the system accountable for health status. So let me tell you a little bit about why health care reform, as it is today, with all of its warts, might have changed my life. I graduated from college in March of 1974, and at that point, I lost my college health coverage. Being over 21, I was no longer eligible for my parents' coverage, one of the first gaps that the Affordable Care Act has already addressed. Since I was young and healthy, I calculated that I'd be okay and could wait until August, when I started medical school, to actually get under coverage again. I was almost right. About 2 weeks before I was to start medical school, I ran out of gas on the freeway, and a few moments later, my car was hit by a truck. I have little memory about what actually happened next, but I do know that I was taken to the closest emergency room and released after it was determined that I was not in immediate danger of dying. I went on to medical school with significant memory and motor deficits. Had there been health reform written as it is today, I would have had a referral to neurology, to physical therapy, to occupational therapy, and surely I would have been advised to take a year off. I would have had a much less traumatic medical school career because I really have to tell you, it's awfully hard to memorize and to learn everything you need to know about how the human body functions when your memory just doesn't work worth the darn. True health reform in this country really does have a long way to go, but I don't want to take away the rights gained so far by those families who have children who continue to need coverage. There were many elements in ACA that directly benefit public health and important provisions that will change the way that we value health care. The midterm elections represent a special threat to the gains that we've made in the last few years in support of public health. Health reform has become a lightning rod for the unfocused fear, discontent, and rage from communities across the nation who see their jobs and their homes threatened. The gap between the rich and the poor in this country has only gotten worse, and communities are feeling the heat. And while Wall Street is doing very well, people are losing their jobs, and families are losing their homes. People are enraged at what they see as the growth of government and the shrinking of their possibilities. The gains in public health both in health reform and in other areas such as smoking, environment, disease control, are seen by many as the intrusions of a growing government, something that challenges their freedoms as well as their pocketbooks. As challenged as health reform is in its current incarnation, it still represents an important step forward for many public health programs. But we still haven't found our voice. We haven't found our public health voice. We haven't found the voice that will say clearly and communicate succinctly to the American public about why public health and why public health and health reform is good for their lives and good for their communities. And I challenge all of us to find that voice because it's really important. And there's a very organized voice working consistently, daily, hourly, and every minute to take back every gain that we've made. In closing, I want to say that there are still two critical areas in health reform where the American Public Health Association has made policy in the past and where we now need a much stronger, effective, and consistent voice. Women's reproductive health took a beating in health reform. We have to work unceasingly to make sure that all women are guaranteed the right to obtain the preventive care they need to support their health and the right to use their own conscience to decide when and how many children they wish to bring into their families. Finally, I think we've done much to begin a daily discussion of how to live a more healthful life, how to build more physical activity into our daily lives. But while we're working to improve the healthy options for our communities across the country, people are deprived of those very same enhancements to their lives. We need to fight for those communities who have little voice, to fight for the safe and healthy recreation for their children. And as I've traveled America visiting affiliates, I've also met many immigrants, cab drivers, waiters, cooks, gardeners, security guards, hotel maids and cleaning crews, many more, who came from Africa, Eastern Bloc, Asia, Middle East, and Latin America, all working hard to provide my meals, sweep the sidewalks on which I walk, take me to where I wanted to go, open doors, feed me, clean my rooms, and keep me safe. Every one of us who's ever worked in public health knows them or has taken care of these families. We also know them as co-workers, translators, nurses, doctors, sanitarians, academics, as well as clients. Many of them come from communities where they have to buy water, not because it doesn't taste as good, but because they have to avoid disease, where girls do not hold the same values as boys, or where poverty or conditions of war simply made living unbearable. The people that I met work as hard or harder than any of us. So, while I am in full support of increasing the nation's fruits and vegetables, I think that it's only fair that those workers who bring them to my table should also be able to afford and enjoy them. Therefore, it is unimaginable to me that our association has yet to make the same kind of principled policy statement that it is known for about the fact that immigrants are specifically excluded from the benefits of health reform. It has been a great privilege serving as your president. I thank each and every one of you whom I got to meet on my visits. I regret not being able to meet more of your communities. It's been inspiring to hear about how you're facing your challenges and the strategies that you're developing to build cohesive communities where everyone can be healthy. I will be proudest of my country when it acts on the principle that everyone who lives, works, and plays here deserves to have the option to participate in a society in which all of us can be healthy. Our theme is social justice. Let us act on it.